And that brings us to our topic for the day. I wanted to introduce our speakers. So we have three speakers, myself, and then Dr. Tristan Huey and Carrie-Ann Van Nostrand. And we will discuss strategies that we have used in our program to advance virtual interviews. And we will all introduce what we do in our programs and then open it up to discussion. And really, we just wanted to have this as a forum for us to all kind of share the ways in which we approach the virtual interviews. It's still a relatively new thing for us, and there are no best practices. And so we just wanted to share ideas of how we can sort of make this virtual interview process better for everyone involved. And so I want to introduce Dr. Huey. Dr. Huey is an associate professor of medicine in the Division of Pulmonary Critical Care at the University of Colorado and National Jewish Health. He has directed the fellowship program at the University of Colorado since 2017. He specializes in the care of patients with interstitial lung disease and was a clinical director for ILD at National Jewish from 2013 to 2017. He still enjoys attending the ICU and passionate about medical education. Dr. Huey graduated from Gonzaga University, attended Georgetown University for medical school and residency, and completed his fellowship training in Denver. Dr. Van Nostrand completed her Doctor of Medicine degree in 2008 at the West Virginia School of Medicine. She completed an internal medicine residency and her fellowship in pulmonary critical care at the Indiana School of Medicine. She then completed an advanced fellowship in interventional pulmonary at Emory, and she remained a faculty member at Emory from 2015 to 2021. She joined the University of South Florida in 2021, where she assumed the role of fellowship program director. When she's not at work, she likes hanging out with her giant schnoodle Lily. And when time permits, she loves baking and attempting recipes from the Great British Baking Show. So thank you to our presenters. I guess I will just start. I just have one brief slide to share. And this is sort of how we approach our fellowship. We decided early on that we wanted to take advantage of the virtual environment and sort of decouple the different components of our day. I know that I personally cannot sit on a Zoom for more than an hour or two, and some of this comes from my inability to sit still. And so what we decided to do was kind of decouple everything and spread things out over the course of about a month. And so it actually is quite intense for our interview faculty, but I think it kind of helps us sort of capture everything in a relatively compacted time frame. And so we do hold a program orientation. And it's sort of the typical orientation to our program. And this happens about 2 weeks prior to our interview. We invite those who have accepted interviews and also those on our wait list. So it's a relatively small group of people. We also invite them to a fellow happy hour. And again, these are decoupled from both the program orientation and from the interviews themselves. It's an hour reserved with our fellows for them to sort of spend time discussing the program or any questions that they have, outside of anyone from the program leadership. Our actual interview day is about 2 hours. We have 4 faculty that interview in total. And we have a brief huddle after each session to discuss our candidates and do sort of a very prelim ranking. I have 2 teams of interviewers, so and I interview all the applicants, and so it's me plus 3 faculty in 2 different teams. I'm actually able to protect the time of my interviewers, and so we actually do it very, very sort of all within 1 week. And so we actually do 7 interviews per team within a week. And so we'll sometimes have 2 interviews per day or interview sessions per day. And then in the end, we end up interviewing a total of 58 applicants. And then in terms of the interviews, we actually utilize behavioral interview questions that align with our program identified attributes for holistic review. And so, the types of questions we ask fit into our holistic review process. And then our final ranking meeting is within 2 weeks of the interview, so that our faculty can still have sort of our applicants fresh in their mind when we actually do the final ranking. And so we rank with all of our interview faculty. And so again, it's a fairly compacted time frame for our interviewers, so our faculty. But this is sort of what has sort of worked for us for the last couple of years. And so far we've had fairly good feedback, both from our applicants and also our faculty. I think part of it's also I'm able to protect their time for that week that they're doing interviews. And so that makes the job of the interview process for them a little bit easier. That's me. Tristan, do you want to share what you do?
I'm going to share some slides just as an overview. I've got 5 slides. I'm going to talk about sort of our interview day schedule and what that looks like, how we're communicating with applicants, and then how holistic review looks with regard to the interview. So we have left it sort of distributed, and we really modeled our interview day very similar to what we had done with our in-person, but we streamlined it to take away sort of all of the breaks and waiting around that used to happen in the old system. What we've done, well, and the reason that we elected to keep it on just a Thursday over the course of September and October was because it highlights our major teaching conferences. And then we found it a little bit easier of an ask for the faculty to devote half days on these 6 different interview days. We also wanted to think about ways that we could accommodate applicants, understanding that sometimes, depending on what their schedule is like, they may not be able to do September, or they might only be able to do October. This is sort of what our interview day looks like. So we also have a virtual happy hour. We have these the night before, again, to sort of give an opportunity to meet with fellows. Part of the way that I think about how all of this is structured is that one of the challenges with Zoom is how do you communicate culture? And so we've tried to have as many group interactions as possible, and tell applicants that one of the purposes is to see how we interact with each other. And so we have panel interviews. When we do our introduction, we have group introductions. For our fellows, we really lean into trying to show fellows spending time with each other and enjoying each other's company. And so for our format, we have that happy hour the night before. I provide some libations for the fellows, and they're just in a Zoom call at somebody's house. And they have the applicants available to ask questions, but there's a lot of laughing and happy fellows. And I don't know how much information is actually communicated beyond that. In the morning, we have an optional participation with our chest x-ray rounds that we do, and then invite them to join us for our pulmonary grand rounds, which is our main weekly teaching conference that's led by our fellows. One of the ways that we also sort of decoupled and streamlined, similar to what May did, is when we were in person, is to give this painful 40-minute overview of what our program was like in terms of training and education and research. And now I record it in advance, share the slides and the recording with applicants a week before they show up. And so then instead, on interview day, we just do group introductions. And so they'll meet with our division head, with my APDs, with my program coordinators, and we just tell them a little bit more about ourselves as people and what that's like. And then for the interview blocks, we've split it into a morning group and an afternoon group. So everyone's invited to the pulmonary grand rounds and the introduction, and then the afternoon folks can take a break and come back, and they do 2 interviews back to back, get a 10-minute break, 2 more interviews, and then have time for a fellows panel. And the way that we do our interviews is that we wanted to increase the number of faculty that we're meeting with them. So we have 2 panels, which are nominally a senior panel that's sort of focused on research, and then a more junior panel that's either a 4th-year fellow and generally junior faculty. The other thing that we do is to try to really communicate who we are. And Everyone has an official website. I think it's critical that your official website is up to date. Ours is really hard to change and has a lot of rules associated with it. So we have an unofficial website that Cheryl Loud, our program coordinator, came up with. And it's basically just a Google site, and you can link to it and share whatever elements of that for your program that might be helpful. We've used it to post things like pictures of fellows and pictures of activities and some of the links that are important to share in advance of the interview day. The other thing that we did, which is an idea that I got from Shanta Zimmer, who is a senior associate dean at Colorado, but who previously led medicine programs at Pitt and was at Emory before that, is to come up with this resource page. The QR code there is a link to ours so that you can see it. But basically what it is it's a list of pictures and profiles of all of our fellows and many of our faculty. And the purpose is to show sort of a more humane side of that. So they get to know us as people, so that they see that there is some diversity in Colorado. It also has a page that says, who do I contact if? And what this allows us to do is to sort of slip in important questions. If you're thinking about having kids in fellowship, if you're a person of color, if you're LGBTQ, and then it's mixed in with these questions about who do you contact if you are a foodie or if you have pets, or et cetera. I think it's been real helpful for us. We also have a second look program that we do virtually after interviews are over to try to communicate more information. And then just the holistic review elements that we do on interview day. When we're screening applications, the way that we've done it is to think about these 4 domains about academic record, contribution to diversity, creative potential, which is sort of the scholarship that they've been involved with, and then leadership potential. And we have our screeners rate them on a Likert scale of 1 to 5. And then we have our interviewers do the same thing. And we use that just as a starting point for how to discuss these things with fellows. So that's sort of an overview of what we do in Colorado. I'll give it off to Dr. Van Nostrand. And you're on mute still, Carrie Ann.
Thank you. Let me share my screen here. To add, I also do not have many slides here, so we will start here. So our fellowship interview day plan, and like many people have said before, this is something that starts well before the day itself. And we've all been working to try to take what we had in person and really highlight the culture and the what makes us our individual training programs. So after our applicants have accepted our interview, they get an introduction email about a week prior. That includes with them who they will be interviewing. We have a strict non-recording policy, so we do like to let that kind of be upfront, which you know, that's something that our institution wants us to say. And then we include a PowerPoint that includes some of the nuts and bolts of our GME program, including information about housing, fellowship life, and like frequently asked questions. Where do we live? What's fun things to do? What is diverse here? What do you do if you're a foodie? What do you do if you like sports? What do you do if you like the beach? Yes, we can say we have the beach. So we do highlight that. We also give a sample of the block schedule as well as the didactic schedule. And then we send them also a short video, about 8 minutes, with our division chief, PD, APDs, and fellow that just talks about what makes us special, why we're here, and where we think we're going as a division, and allow them to kind of look at this on their own time before they come. The day itself, we start with a 15-minute introduction, and similar to Trishan, this is an opportunity to showcase an interaction between all of us. So the entire interview panel, including our division chief, PD, APDs, you know, it's there to do a quick welcome, have them know who we are again, and see us interact. We have a total of 5 20-minute blocks, and then follow that with a 5-minute wrap up, and then send that over to our 30-minute. And again, this is 30 minutes. Sometimes it's gone well over this into an hour for fellow Q&A, but we do allow this time for them to kind of put that into it. But, again, I think all of us struggle with the time crunch and the time commitment that we put on our faculty. So taking advantage of the virtual has been helpful to try to truncate this and break it up. The way that we do this, we do 5 candidates per session, and then this is spread over about 3 weeks based on the faculty that are interviewing. We do 3 faculty interviews per candidate, which are combined with 2 faculty. So we try to have a mid or senior career with junior faculty, diversity of where they've trained, where they've come from, to allow for improved discussion, but also to highlight the interaction between our faculty. And then we have 2 opportunities for what we call team room time, and we're using this to highlight our culture. And this is where we ask for volunteers from our respiratory therapists that we work with in the Bronx suite, the nurses in the ICU, our APPs, our clinic staff. And this is an opportunity for them to see the culture of our place, ask questions where they're not necessarily being, graded, but really give them some time to see that culture and those interactions that we used to see in the hallway when we were there. So that's something that we've incorporated into that. It's also a good time for any body breaks that anyone needs. So just something to add in there. This is kind of what the day looks like. And we won't spend too much time on that, but that's really kind of what we've done. We'll leave it for questions. I'll stop sharing.
Great, thank you guys. And so at this point, I wanted to sort of open up the conversation to everyone in terms of the audience. And I guess we'll start off with questions about any of the formats that you've heard about today. And then after that, I think I would like for everyone to kind of share what they do, and maybe, we can kind of learn from each other what has worked well and maybe what hasn't worked well for people. Catherine Melvin, you want to?
Yeah, hi. It's Katie Melvin from UCLA. Thank you guys for giving this presentation. I think one question I had, and May, it might be mostly for you, and then maybe a little bit Tristan as well. So one piece of feedback we've gotten is our interview day is very long, and admittedly, we actually didn't change the format at all from how we used to do it when it was in person. And so it's a very long day, particularly I think the people from the East Coast, say it ends very late. Of course, they start 3 hours later, but in any case, part of that is because we end our day with the fellows happy hour, similar, I think, Tristan, how you do it, like a Zoom thing, which has been really well regarded, but it lengthens the day because we don't do that until after our fellows are off rotation it starts at 5:15. And so one thought I had was, should we do it either the night before, like you do it, Tristan, or then decouple it completely? And I just was wondering, how is attendance when either you do it the night before or even decouple it? Because my concern is we leave it optional also, like not every fellow or applicant has to stay. But my worry is for us, it seems like such a selling point of how you get across culture of a program. So we don't want to decouple it and then lose half of our applicants, although I guess you could make the argument that the half that aren't attending maybe weren't that invested and interested to begin with, but maybe we would have convinced someone if they had seen how our fellows are socializing. So that was one question I had for both of you guys.
Sure. I guess I'll just speak. We have not had an issue with attendance at all. I think people really value the time that they spend with the fellows, and I would say they probably most of them actually want to go to that over anything else that they do, especially because we tell our fellows to be completely honest, and I really want them to be honest because I think it's important for whoever comes to our program to really understand what it's like to be here. And we may not be the program for everyone, and I think it's important to know that off the bat. And I think that interaction with the fellows is really, really important. I think the applicants recognize that as well. And so I don't think we've had any issues with attendance at all. Tristan?
Yeah, I think it's critically important too. We do it twice. So we do it the night before with a happy hour, which is mostly my fellows having a drink and some food and talking to each other and some to the fellows. And usually we get probably 80% of folks will participate in that. And then we have fellows sign up for this fellows room on the interview day. And there's 2 blocks for that because we do our blocks. We do 4 in the morning and 4 in the afternoon. And so there's usually 2 to 4 fellows who are in the hospital doing something else who come over and attend for that. That used to be where we bought the fellows lunch with the applicants, which was a draw. It is a little more challenging to get fellows to want to sign up for the fellows room, which is less fun than the happy hour.
All right, I'll add, we used to do the happy hours and we would have 2 interviews, like let's say a Tuesday and a Thursday. So we would do it on Wednesday in between, and then would do a summative at the end in case there were any last minute questions. And actually our fellows themselves actually wanted to move it to the interview day more than the happy hour. I don't know what that says about our culture here, but they thought that they would do a better job conveying our culture on the interview day rather than the happy hours. So that was something that we're trying this particular year. So
Great.
we'll keep you posted.
I like the way Ren says in the chat that in Cleveland, they have them sort of scheduled throughout the interview season, and you don't have to go to the one that's associated with your interview day. And we've done that too. And we've said, you can't make it to our teaching conference that morning. You can come to a different one, or you want to see it again. I think that's a nice flexibility of the virtual also.
Right. Peter, I saw Peter and then Jason. So Peter, you want to go ahead?
Yeah, thanks, Tristan and Carrie Ann and May. This has been a great, forum. I had a question for Carrie Ann. With the RTs doing the, hour or so or half hour, with a group interview, that's a wonderful way to show culture. My question is how do you get the respiratory therapists and the staff to do it? In other words, some places have a pay structure where the College of Medicine has nothing to do with RTs, and you can't give teaching points or academic credit to the RTs for giving their time. And so often they're trying to cover the floors and also the MICU and everything. How do you get the personnel there? Because that is a wonderful idea. I really like that.
Yeah, I can say this is the first year that we're doing it. So it is a volunteer basis. We can have them sign in kind of to the Zoom room. And I think we're really blessed that the team that works with us and works with our fellows really are invested in them and our continued success. And so it's a volunteer basis, and they volunteer whether they're at work or even at home to do this and, continue towards our success. So I think we're blessed in that regard, but yeah, we'll keep you posted.
I like the idea about the one from home, possibly. I understand the ones at the hospital, can be busy. A lot of our RTs are very vested, in our fellows, particularly in the MICU. So maybe going the route of the RTs at home, or, asking somehow if they can get some type of credit from their own pay source or whatnot. But basically, I think having them at home sounds like a great idea. Thanks so much for sharing.
Jason, did you have a question? Your hand is down again, but Jason Moore.
Yeah, hi everybody. Sorry, I wasn't sure if you could even see my name, but I guess you could. So I'm wondering what the panel thinks about in the brief introduction during the interview day about talking about post-interview communication and some of the match rules and things like that. Just verifying that that you do follow the code of conduct and so forth. That's something that I decided to put into our brief introduction, just to make sure that people realize that we're not trying to ignore people, but we're cognizant of the fact that vague communication can cause trouble and so forth. So just wondering what you guys think about that.
I was going to say, I do put that NRMP communication thing in my PowerPoint as well. I think it's important to lay out what the communication, I guess not strategy is, but the rules around communication are. And, people may feel miffed if they don't get a response, but if you tell them up front, we're just trying to follow, or actually what I do is I send actually a very generic email, and I actually send this email to all of my fellowship faculty interviewers so that we can have the same response whenever they get emails from applicants. And it's a very generic response that says we're trying to follow NRMP rules, but I think it's important to lay it out there in your intro, just saying we're just trying to follow the rules, and we're not trying to, stifle communication, but we really want this to be a level playing field for everyone. So I agree, Jason. It's important to lay it out there and say, this is the expectation, or this is what you can expect from us, and this is why. I'm sorry, Tristan or Karen?
No, I agree. I mean, we lay out expectations too. I think that there's some variance in how people communicate with applicants around the time of these interviews. I think that the NRMP rules say that you can talk to people, you have to tell them the truth, and you can't coerce them or ask what they want to do. And so we invite them to ask us questions, because with our interview structure being a single day, they might not be able to meet with the people that they want to, or they may have questions afterwards. And I want to be able to answer those questions as a PD. And so I do respond to emails and put them in touch with people to help with their decision making.
Yeah, I think for us, it's about making sure that everyone has the ground rules expectations, and that we're committed to following the process and supporting the rules to make it as equitable as possible. I mean, that's what we're here to do.
Yeah. Well, and I want to say, I do answer questions. It's not like I shove everyone off, but like if they ask about certain things, and then I tell everyone to just send a generic email. But most of it is just kind of like, thank you or whatever. Z?
Yeah, May. That's a great idea to have a uniform statement from all of the faculty, because you don't know who's going to receive the email and what they're going to say.
Right.
And it kind of helps them not have to think about it. But I like you, Tristan and Carrie-Anne and May, I also struggle with people who are asking genuine questions, and I don't want them to feel bad.
Right.
On the day of the interview, I tell them, if you think of sending us a thank you note, change that to go out and have a coffee or ice cream, and that's going to serve you and us better than anything else. But then I also tell them, if you want to contact anyone, the fellows are a really great resource, but I also don't want to block that pathway of communication. But then I don't want them to feel obliged to ask a question that they really know the answer to, but they just don't. They just want to show interest.
Right.
But I have a question, not just a comment. Any of you use, or any of the audience use, a pre-interview part of an evaluation, not a second application, but kind of a start the interview process before the day of the interview, because we wanted to shrink our day to half a day only, or 4 hours. So we send actually a couple of things to the candidates ahead of time, just to ask them a couple of questions. So I'll
Yeah, I do
offline.
actually. I'm with you. I send them, and they're very, very simple, and they're the most commonly asked questions. I don't have them in front of me, but it's like, where do you see yourself in 5 years? Do you have any interests, subspecialty interests? And so some of that is just so that we can kind of get those questions out of the way, and also so that we have a sense of what their interests are even before they come to interview with us. And then it allows us to kind of focus in on our behavioral interview questions that fit in with our holistic review, because time is a huge thing for us. We're trying to save everyone time in decoupling everything, and by asking some of these most commonly asked questions ahead of time, we can get those questions answered. Everyone can see them, and then we can focus on other things. But I'll let Tristan and Carrie-Anne talk.
Yeah, we don't ask questions in advance, but I like the idea of it.
We don't either, but I like the idea. Have you gotten any post-interview feedback about those questions, or what the applicants feel about that?
I haven't gotten any feedback, positive or negative. People do them, and I say I tell them it should be like 200 words or less. I mean, it's not meant to be onerous. It's just meant to help us get to understand who they are, what their interests are, and whether or not, we can fulfill their interests in our program just off the bat. Z, how's yours been? Like, have you gotten anything?
So I've asked about it during the interview, so I don't know if the answer is genuine or not, but that's the struggle. People have said that they like them in general. They weren't sure if they will contribute to them continuing to get the interview or not. So this year, I'm gonna say your answer to these questions will not affect your candidacy for interview. We're not gonna cancel on you. That's what I'm saying. Yeah, so I'll make that clear. It just cuts down the time a little bit. And again, the candidates probably, my intention was for the candidates not to have to repeat themselves with every interviewer. But we also moved to every interviewer has a different task to ask about. So not everybody is repeating the same questions.
Right. Yeah, we do it the same way. We kind of assign different types of interview questions to different interviewers. And like you said, Z, I find it saves a lot of time. And actually our interviewers also like that they have these questions in front of them, so they're not asking the same things over and over again. Again, it's for us, it really helps us hone in on what we're looking for in our candidates. Any other questions? There was a question about second looks. I don't know that a lot of people are doing second looks. I'm not doing second looks. Is anyone else doing second looks?
We are not.
Yeah, we're not either. I know there's interest in it and there's been some discussion about it. I mean, this is the whole intent of the ROL lock thing. And so I would say just hang on and see. Because again, the whole second look thing, virtual or not, can open up a whole other can of worms. So I think we haven't gone there yet. And I know, we as a society are looking into sort of what other people are doing, what NRMP is going to recommend, and just sort of take it from there. Ren?
Hi, yeah, I just wanted to say something about that. So as some of you know, we studied this last year under an IRB that we actually gave candidates the option of choosing to have a second look if they wanted to. And that was based on our study from before. Sorry, I got to close the door here. I have rowdy friends. But the study we did the year before showed that was the largest by far choice that people made in the thought experiment. Like, what would you do if we gave you the opportunity? They said, oh yeah, a virtual interview with an in-person follow-up later. And so we actually said, well, let's see what you actually do when we give you the choice. And so we looked at our PCCM and CCM programs combined, and a very interesting result. A lot of people up front said, yeah, we'd like to have an in-person follow-up visit. But out of 88 people, guess how many people actually did one? 3. So it's actually not something that when it comes right down to, oh, I have to pay for this, I actually have to take time off for this, that as many people actually do, when it's not required and it's not what most places are doing. So I think it'll be very interesting this year when some places are saying, sure, if you want to come for a follow-up visit, go ahead. But based on our data, this is something that when it comes right down to it, candidates are saying, that's really too expensive. So we'll see what they do.
All right. Anyone else have any questions? We can also open up to what other people are doing. I mean, we realize that Tristan, myself, and Carrie Ann are not, necessarily, the standard bearers for any of this. But I think it's important for us to sort of share as a community what works and what doesn't work. And so if anyone wants to sort of tell us what works well for them, or what you have tried and has not worked so well.
May I? I'll add one more thing.
Yeah.
So what a lot of programs are doing, which are every interviewer asks different set of questions. Actually, we studied this just 2 years, over the past 2 years, because we had both. We had the behavioral interview stations or multiple interview stations, and then we had the classic interview. And the scores from the multi-domain interviews actually ended up in a normally distributed curve of scores versus the classic interview, which were skewed. So I'm glad to report this, but I don't know what it means long term, of course. But it just helps the selection group choose from a normally distributed set of candidates scores instead of a skewed candidate scores.
Anyone else want to share anything? Thanks, Steve. If not, I mean, I think, you know, at least the three of us has demonstrated that there's very different approaches to how to conduct interviews now in this virtual world. I mean, there is no right or wrong. And I think, you know, oh, Zahara, sorry. You want to go ahead?
Hello. I just had a quick question. And has anyone tried to do like an Uber Eats or any type of like a town hall like the day before with the fellows? And if so, what was this the most successful method in doing so? Any
We give actually Starbucks cards to all of our interviewers or applicants, sorry.
okay, applicants, yes.
Applicants. And you know, it's meant to be part of like the happy hour thing, but I mean, it's a small gift, but I think it still is a nice, because we used to provide lunch and we don't provide anything anymore.
Yeah.
So we figure like a small token of, you know, like, hey, enjoy coffee while you talk to our fellows.
Yeah.
It's kind of a nice gesture, but we don't really do much more than that.
We were thinking about trying to do like Uber, like send Uber vouchers, and then we could all like eat together. To try to make it more personal before we do questions with the program directors and fellows. But great, thank you. This has been really helpful.
I will say that I'm not on the panel, but we actually do Uber Eats for our happy hour for our fellows. That's to entice our fellows, and then the applicants as well, to again try to mimic what actually was the dinner that we had together. But then our day goes too long, so I don't know that we've been successful in that.
Did you send vouchers, or how did you have to set it up?
Yeah, we get Uber Eats. My program coordinator does it so much through our GME office. She gets an Uber Eats code, and that we send to them, and then they use to order dinner. And we send it like the morning of the interview.
Great, thank you. All right.
Cool. Well, I can end it unless anyone else has anything else to say.
I think there was a question in the chat of the idea of assigning questions to different faculty, and if anyone would be willing to share some of the questions that they provide.
Yeah, I mean, we use standard behavioral interview questions, and I group them into categories, and I actually just have my faculty choose which category they're most comfortable with. And that way, like we said, we're not sort of repeating the same thing over and over again, and we're all kind of sussing out a different aspect of our applicants. I mean, I'm happy to share the Word document. Again, it's copied and pasted from the web, so there's nothing like special about it. Peter asked a quick question. Does anyone give tours of the hospital to applicants who want them? Like in-person tours, Peter, or virtual tours? Yes, if they ask in person. We are not.
Don't either.
Yeah, I mean, we've had candidates ask like, hey, I'm taking a vacation in LA. Can I swing by? And we always say no. Plus, I mean, you have to get them like there's all sorts of like hospital loop issues that you have to deal with, like HIPAA and all that. And so we don't. Yeah, I agree. It's not worth the effort. Plus, I mean, you don't want to give people advantage over others. I mean, of course, the internal candidates all know what it's like, but that's a whole other thing, right? Thank you, Z, for sharing.
You're welcome. This is from University of Michigan, and I actually got it from one of the meetings of the APCCMPD from probably 20 years ago or something like that.
Awesome. Anyone else have anything else they want to share? If not, I hope this was helpful. I think it's always interesting to hear what other programs are doing. And I hope that some of these ideas will be useful to you guys going forward. And also, I mean, I've certainly learned things as well, and will incorporate some of these ideas into my upcoming interviews in a couple weeks. So thank you everyone for sharing. It was really great to see everyone. I hope to see you guys at our next virtual check-in, and have a fantastic day. Thank you all. Bye.
Hey, everybody.